Nearly 500,000 people receive medical treatment each year for burns, according to the American Burn Association. But a new product is changing the way the worst of those burns are treated. Teresa Snow shows us how spray-on skin is helping one man heal.
Eli Beasley started playing guitar in the Marine Corps, but lately it's become a sort of therapy.
That was one thing that helped me out tremendously to get my fine motor skills back.
His life has been a stream of hospital visits since October 2018. In a moment of carelessness, this professional firefighter tried to light a bonfire with a gasoline mixture.
The flame just kept coming back and coming back and coming back. And I could feel hands on me, and I kept trying to roll towards that person.
Eli was taken to University of Missouri Healthcare's Level 1 Trauma Center with burns over 75% of his body.
A major burn patient in any one hospital is maybe the sickest patient in that hospital at that time because it affects the entire body.
Traditionally, in very large burns, doctors harvest small bits of healthy skin to grow into sheets of skin for grafting. But Dr. Jeffrey Litt was one of the first surgeons in Missouri to also use a newly FDA-approved treatment called spray-on skin. A small sample of healthy skin is taken from the patient, an enzyme is used to break apart the skin cells, and the solution is sprayed onto the wound. The cells start growing to form a new layer of skin.
The expansion ratio is huge.
Clinical trials show patients recover more quickly using less skin than with the traditional skin grafts. Eli's had more than 20 surgeries and countless hours of stretching with MU Healthcare's physical and occupational therapists. But through it all, he's remained overwhelmingly optimistic and hopes to be back to fighting fires.
You have to wake up every day and choose to pick up the pieces of your own life.
Finding himself one note at a time.
Dr. Litt says spray-on skin won't be the right choice for all patients. He's found it most useful for patients with a large surface area burn and less healthy skin for grafting. Nearly half of all adults in America have some type of cardiovascular disease, and new research shows invasive heart surgeries may not be the answer for everyone. Mandy Gaither has more.
Those with stable heart disease may fare well on medications alone instead of having invasive procedures like stents and bypass surgeries, according to a major trial. The findings were presented at the American Heart Association's yearly conference. While chest pain and quality of life in some patients improved with invasive operations, the trial found those procedures didn't significantly change subsequent heart attacks, hospitalization for unstable chest pain or heart failure, resuscitation after cardiac arrest, or death from heart disease. The trial, launched in 2012, included research on more than 5,000 patients in 37 countries, which researchers say is the largest study of its kind. The study's chair estimates hundreds of millions of dollars would be saved in the U.S. if patients without symptoms forego invasive surgeries. For today's Health Minute, I'm Mandy Gaither.
Experts say debate continues in the medical community, but patients should discuss the benefits and risks of both medications and surgical solutions for heart disease with their doctor.